the movements of the hip joint. Before we come into the topic, let's get oriented with the specimen you see here on the left. That is, the bowl of pelvis can be seen along with right and left hip joint, which articulates the femur. It can also be appreciated here. Now, above this, you can see all the 5 lumbar vertebrae: 5, 4, 3, 2, and 1. Now, look at the muscles. That is the psoas major, which is arising from the lumbar vertebra, and iliacus, which is arising from the ilium. Both psoas and iliacus runs distally underneath the inguinal ligament, as you can see here, the inguinal ligament, and get inserted to the lesser trochanter. So now imagine these muscles are contracting. So this will effectively cause a flexion or an approximation of the hip joint like this. On the right side, you can see how the hip joint flexes. So that's a flexion of the hip joint by contraction of the psoas and iliacus muscle. A similar picture is a posterior view, where again you can see the wall of the pelvis, the hip joint, the femur, and the upper tibia fibula, and the knee joint. So here we can start with this muscle. That's a gluteus maximus, which is arising from the sacrum, sacrotuberous ligament, and getting inserted into the gluteal tuberosity and the posterior end of the femur like this. Now imagine this muscle contracts. It will be pulling the femur behind towards the pelvis. So that is going to produce the extension of the hip. So that's extension of the hip. One more group of muscles we will have to introduce now is the hamstring muscle. So this is the ischial tuberosity. You can see it here. That's the ischial tuberosity from which the hamstring muscles arise. It's a group of muscles which will come down and cross the hip joint. It will also cross the knee joint and get inserted to the proximal tibia. Now imagine these muscles are contracting like this. These muscles are contracting. It will first cause a flexion of the knee joint plus a mild extension of the elbow joint. So in nutshell, the hamstring muscle causes extension of the knee joint, extension of the hip joint as if in normal walking, and gluteus maximus helps in extension of the hip joint, forced extension of the hip joint, or when you need the hip joint while sitting, standing up from sitting position, running, etc. So these are the two abductors, the gluteus minimus and gluteus medius. So a contraction, so it is arising from the gluteal surface of the pelvis. So it's a gluteus medius and there's a gluteus minimus. These are the anterior, the inferior gluteal line and the anterior gluteal line. So here a contraction will cause abduction. As you can see, the abduction of the hip joint here. The contraction of the gluteus minimus and medius will cause an abduction of the hip joint like this. Okay. Next is adduction. Now you can see the group of muscles called adductors arising from the ischiopubic ramus like this. The ischium is behind, pubis is in front. So ischiopubic ramus, the lateral surface of the ischiopubic ramus, you can see the adductor muscles, namely brevis, longus, and magnus. All these things are getting inserted to the medial lip of the linea aspera behind, as well as in the adductor tubercle here. So a contraction will definitely cause medial movement of the hip joint. So as you can see, the red tag is pulling it medially. So that is the action of adduction. Similarly, again, we are coming to the posterior view of the pelvis and the hip joint. Now here we can see some muscles arising from the sacrum, that is the piriformis, from the obturator membrane, that is obturator internus, and also muscles from the posterior aspect, namely the chordatus femoris, inferior gemellus, etc. So all these muscles, let's take it as a group of muscles. If it pulls, the femur or the hip joint will move backwards and laterally. See, like this, lateral rotation, backwards and laterally, like this. So it's a pull from behind. Sacrum is seen from behind. The pelvic bone is seen from behind. So a pull will cause movement of the hip bone laterally and posteriorly, which will lead to the rotation or the lateral rotation. Thank you.